So I guess welcome to the Direct Primary Care Show. This is just you and I, the only two real ones uh, in this Boonesboro, Forest, Lynchburg area. This is Dr. Anderson who I'm talking to. I am Dr. Frago. Obviously, the biggest news going around today is he shaved.
I know. I'm in mourning still.
Yeah, I mean, and you did that because of better mask coverage. Is that correct?
Yeah, we're wearing N95 masks all the time now, and with the beard, it doesn't fit like it's supposed to, and so I had to say goodbye to that friend.
I understand it. You look like your 12-year-old brother. I
I
don't know if
know.
you have a 12-year-old brother, but I just want the people to be aware of that you are the same person I was speaking with about a week ago. Now, I'm probably going to be putting a Farrago face touching meter on my thing after I edit this because I cannot stop touching my face. I'm not sure how good you are at that. But we're now not set. We're not in the same room because of the obvious social distancing. And I'm going to wash my hands after this, but I will probably touch my face. I'm going to predict 30 times. It was pointed out to me I did that last time. How are you holding up over there in Boonesboro?
Oh, it's good. It's good. I come into the office every day, but the majority of our appointments are over the phone or video, and patients are really understanding, and it's nice that we can actually do this, that we're set up in a way. We've been doing this for a long time anyway, and so we had the skids greased, so to speak, before all this started, and so it was
correct. Like, so that is one of the things that is very interesting. And I feel bad sometimes for a little bit for our brethren in primary care because they make a living by seeing somebody and getting paid per visit, which, by the way, we both believe is a flawed model, and that's why we're doing direct primary care. With direct primary care, it's a monthly fee, whether you see me in person, whether I call you, email, text me, or you video call. And so that's why it's seamlessly worked during this pandemic. Which has been another, as people are starting to realize, because I'm actually getting more people join now during this time than normal. You've had some people join as well, your practice?
Mm-hmm.
Yeah, it's pretty cool that people understand that we can, we can do anything, almost anything by telemedicine. Now, if I have to come in, I will see them, but we're the same. We've shut down, and we were earlier than most because the bottom line is the infection's probably in the area. Well, we know at least 3 cases, correct? That you're hearing at least 3 or more in the area?
Yeah, I mean, I've heard we're almost, what are we at, 9 now? If you count, right? Yeah, Amherst and Bedford.
Okay, counting those, yes.
Farmville was included in that. Per the health department folks, that is close enough to be considered in our area as far as epidemiology goes.
And this virus will track 5, 6, 7 days later. So people are asymptomatic. That transmission is the issue. Statistically, this is a problem, right? Because so many people are asymptomatic, never get symptomatic. Then if they're tested, it'll make it look worse than it is. I don't understand. I'm confused. You can even teach me some stuff here.
What it all boils down to is that every patient is asymptomatic for a while. That ranges from, on average, 2 to 9 days. It's the average time is 5.1 days, and so everybody who ends up with coronavirus is asymptomatic for some period of time, which has led to these large, sweeping lockdown mandates.
Do you see now? What are you doing for testing yourself right now?
I have been working with the folks both at Centra, their offsite testing facility, and then also at the health department. They've been at the health department. Mrs. Evans, Haley Evans, has been really great to work with. So
yeah, the same with us. So right around the corner from our office is Centra has their drive-through. We can send people over there. Again, if you're a laceration, I'll repair in my office because I'm not going to send that person to the ER, and that's free, by the way. Part of our membership, we sew people up and don't charge a dime. That's thousands in the ER. Also, don't want them exposed in the ER to anything else. So we're going to see them, but rarely do I see anybody because of this reason. And if they're they meet criteria, I have to send them around the corner to be tested. You've done a little bit on the microbiology and give a quick summary of your thoughts about this virus and why it's so devastating.
So yeah, so I've done a lot of reading. I'm doing all my visits over the phone or video, and so I have time by myself in my office. So I've been doing a lot of reading on the microbiology just to help my patients initially understand from that standpoint why this is so different. And it is it is different. Do you want me to talk about like the three reasons why it's so different?
Absolutely.
So it boils down to just three things. First, you've heard this called the novel coronavirus. The fact that it's novel means that it's new. It started off as an animal virus, and unlike the flu virus, which this has been um, referred to a lot and compared to a lot, that's a human virus. The flu virus is. This is an animal, so our body doesn't know what it is. It doesn't know how to attack it, and because of that, the immune system has to turn up the power on itself so that it can effectively wipe out the virus. In doing so, there's some collateral damage with the lungs, sometimes a whole lot. And so that's one of the problems. And then the second part of it being a novel virus, we can't form an immunity in many cases. You've heard cases about how there's reinfection. That doesn't happen with things like the flu. If you get the flu that season, you don't get that same flu that season. It's another strain that you'll get somewhere down the road years later or the next year. And and so we can't form an immunity very well to it, and so it'll just keep cycling around, and that's why we're trying to snuff it out now with all these lockdown mandates. The second reason is coronaviruses are it's a family of virus, and the novel coronavirus that we've been talking about is different where it attaches. You've seen these pictures of these little spike ball viruses that they show on CNN and Fox. Um, Usually those attach to the tissue of the nasal passages with most coronaviruses, and that doesn't cause too much of a problem. We get a runny nose, we get a cough because of it, but that's about it. This one has receptors that stick specifically to the tissue of the lungs, and that's where it attacks and causes the damage. The third reason is why this is so different is that it mutates a lot. Um, it In a genome of any organism, there are something called SLP genes. Getting a little sciencey here, Doug, but I'll explain it. There's SLP genes, and those are the portions of the genome where mutations typically occur. Scientists call these SLP genes that mutate a whole lot. They're deemed slippery, and that just means that they mutate frequently. And the coronavirus that we're all talking about is super slippery. And because of that, it mutates a lot. That was evidenced in the very end of December when this was first discovered. It was the WHO had been tracking it for a while, and also the Chinese version of the CDC, because it was animal to animal, and then at the end of December, it switched to animal to human transmission, and then in only 2.5 weeks, it switched to human transmission, which is insane. That doesn't typically happen. It often doesn't happen ever, but the fact that it happened here and that it only happened in 2.5 weeks is important. And then there's a second strain that popped up. There's the S strain that was the original strain, and now the more virulent L strain that is causing a lot more problems. So those are the three reasons why microbiologically this is just a different animal, and because of that, it should be treated with a different level of care.
Yeah, I mean, obviously, listen, I've never seen the world close down like this in my career and my life, actually. And so the world obviously knows something's going on. This is actually I mean, as bad as this is, and it is bad, it's a dress rehearsal because I think this will teach us next time. Because listen, let's be honest, this is a terrible thing, but it's not affecting little kids, not much. I mean, hardly ever. Even younger people, you can look at the statistics. There's cases that are brought up by the media, and I get that, but at least it's not like polio, correct? Where we were affecting all these young kids, and so that would be as bad as this is. That would be absolutely horrific, and hopefully this will be our dress rehearsal for if God forbid another thing happens in the future. So I think that's if anything good comes out of that, that we now are like, okay, we've had the drill, which was terrible, but this next one hopefully never will happen. But if it is, we'll be ready because that's what scares me the most.
Yeah, we're learning a lot in medicine, and as a society, governments across the world, we're recognizing there's this kind of this point in everybody, I think, that's in a leadership position or a healthcare position where we're like, how did we not see at least part of this coming? And been a little bit more prepared. But I mean, this is unlike anything we've ever seen in the world. You can't be but so prepared.
Yeah, I get that. Where we blew it up is, well, we've never been used to social distancing. We're never used to shelter in place. So that's, at least we have a reference point in the future. So I think we're going to get past this. Hopefully there'll be minimal damage for a couple reasons. And I don't think a vaccine will be in time. Maybe it will be. I think the heat will do something. It doesn't do, now, correct me if I'm wrong on this. Listen, we know there's some it aerosolizes, gets in the air, but that's not the big way. The big way is idiots like me who touch my face, but I'll wash my hands. But I mean, it's on surfaces and it stays on surfaces for a while, correct? Is that what you're hearing as well?
Yeah, they say up to 3 days. When that first came out, they were thinking 9 days, which is insanity. Now it has settled down where it looks like 3 days is what they're thinking, and it sticks to more smooth surfaces, glass, think of your cell phone, that it sticks to and survives the longest. These porous or even fibrous kind of materials, it doesn't seem to as long, which is part of what we're thinking is why the CDC came out with some of the newer recommendations. I don't know if the recommendations as so much as, hey, you can do this as a last resort, referring to those masks that people can make on their own, like fabric.
Yeah. Well, the other thing with the N95, the whole part with that heat thing is they've realized you can put an N95 mask in a sauna or your oven, and for about 30 minutes, and it'll take care of it. So we know heat's going to be, when it gets warmer here, down here, that's going to be better, I believe, for lessening transmission and killing things on surfaces, at least that's on the outside. I can't tell you the number of days that's going to happen, but there is some hope on that. But I think going back to the mask definitely helps if you have it, so you don't give it to somebody else. The mask helps for healthcare workers who are the highest risk, blocking them. But others, it's okay. It's not what you really need. I guess you really not need to do what I do, which is touching your face and touching the surface. I will wash my hands. I feel like Ricky Bobby here. I'll wash my hands when I'm done here, and I washed them before. But I just want people to realize, don't do what I do. You want to be not touching your face because you're going to put this stuff. If you're a big nose picker, it's a problem for you, correct?
Yeah. I've got my eye on you. Make sure you're not touching your face.
So, okay, so what we have is, we talked about testing, we talked about what's going on. I got to go through one more controversial issue, the hydroxychloroquine issue. To me, there's maybe something there, but it's maybe not something there. What's the latest you're hearing on? That's Plaquenil and azithromycin combined.
So this is a unique time, as we've discussed. And so all these studies that I read are very unlike studies that you usually read. Usually you'll read a study and they'll say, there were this many patients, which is a huge number. It's usually in the hundreds of thousands. And we studied them from 2015 to 2018. And we spent the year compiling all the data, and bam, here it is. And so the studies we're reading now, it's like, hey, this came out of France, and it's whatever it was, 36 patients or 24 patients, and it's from the 6th of March to the 16th of March, and we published it on the 17th of March. And that's what it was. One of these big studies that came out looking at hydroxychloroquine and azithromycin, that's what it was. It had an 11-day turnaround from the start to the publishing of it. And so information is coming out rapid fire. It's not curated like stuff typically is. And so you have to be really judicious in what you consume, and as far as literature, medical literature, and looking at the flaws, that you have to look at the flaws of the studies. And there were some flaws in this study, but it does give us some hope. We're not sure. There's research coming out of Washington State now saying that, in our population, it doesn't seem to be super helpful. They're still looking at it as possible prophylaxis, meaning you take it before you have the disease as a preventative measure. And so some of it is still anecdotal, but everybody is doing a full court press. We're looking at all kinds of things, and something will come out of it.
Yeah, I listen. The guy from France who that he is like he's like the I mean, he has like tons of people, like 800 people under him. He's got a reputation that's questionable at best. Now we brought politics into this, which is never good in medicine, and so people are attacking or being pro towards these studies because of their political ideology. That's a mistake, right? We got to keep that out of this. And so you can't read what the media says both ways, right? So the right media and the left media are attacking or supporting, and neither of them should be believed. We're going to have to wait and see. So the reason I'm bringing that up, because I'm hearing, I've already had some emails from patients talking about, hey, can I get me some of that? And I'm going to tell you, this is the first time in my career that pharmacies are blocking that. And they want, they're not letting us even do that. And so, people should be aware they're not going to be able to get that from us until there's some, and the A-OK and the thumbs up. I can't do it. You're probably hearing the same, correct?
I mean, it doesn't come without complications. I mean, a very obvious complication is something called QT prolongation, where it monkeys with the heart rhythm. And obviously that's not something that you want to do. And both of these medications stay in the system for days. Hydroxychloroquine is, I think, 13-day half-life, and azithromycin is over a week. Yeah. And so if you take it together and you start having heart problems, you can't just stop the medication and it go away. They're in your system for a while. So you just have to be really careful with how you approach these things, because you can't get out of Dodge really quickly. If you need to stop the medication, it's still stuck in your system for over a week and almost 2.
Right. Well, listen, I tell you what, I think we'll keep doing this, try to do this for our patients as well. I'm emailing them regularly. I know you are as well, but this is, I guess, for the general public. I'm not seeing many other physicians do this in our Central Virginia area. So we'll keep doing it if you're okay doing it.
Yeah. Something that I think we should put out there, and we can just do like another quick video today and you can publish it in 2 days or something, is us talking about what to do if you think you're exposed. I've gotten quite a few calls of
do it
legitimate
now. Tell us now. What you got? Give us a plan.
You asked me the question, tee me up, and I'll.
Yeah. So what do you do, Dr. Anderson? You've been exposed. Go.
Okay, so if somebody has been exposed, which I've gotten a few calls from folks who have legitimately been exposed to people who have tested positive, what do? You lock down. You self-quarantine. You have somebody deliver the supplies that you need. Don't realize, you get that phone call and your office mate calls and says, hey, I tested positive today. They just called me, the health department hung up with me 30 minutes ago, and I wanted to let you know, you need to start your quarantine right then. Don't go to the store and stock up. Have somebody else go to the store and leave it on the back step for you. And the recommendation is 14 days. That's coming from the CDC. That's coming from Washington State and New York. These places who have experienced it, unfortunately, quite a bit. And so you just take care of yourself until you start mounting a fever. Be in contact with your doctor right when you first get that news. And then if the point comes where you're sick enough that you need to go to the hospital, then you go to the hospital. You don't run out and get tested when you're asymptomatic. We don't have the ability to do that right now because test kits not only are in short supply, but there's a big backlog. Here regionally, we're sitting at about 6.5 to 7.5 days turnaround from when you get tested to when you get a result. And so running down to one of these facilities that can test you when you're asymptomatic, they'll just turn you away. And so, and you've exposed yourself to a place that is testing. So theoretically, a place that has more germs than most places. So just stay at home until you start becoming symptomatic. Be in contact with your doctor right off the bat, and keep him or her up to date, and he or she will guide you as to what to do while you're in that quarantine process.
If you can contact your doctor, right? So, so for us, you can pretty regularly text me and you regularly. Let me add one other thing to that. Let's say I'm at home, I'm in my 14 days, day 5 and 6, I'm getting a fever. I'm not too bad, but I don't know if I'm short of breath or not. Anxiety is going to make me short of breath. I'm going to get anxious and it's going to make me think I'm dying. But I've told patients they can go online, Amazon, and get a pulse oximeter to see what their oxygen saturation rate is. If that starts dropping to the low 90s, and normally it's to the high 90s, that's a concern. Actually, numbers I've seen online is about 92%. You got to start thinking about going to the ER. There's actually phone apps you can do that as well. I'm not sure they're as good, but yeah, you can do those phone apps, or you can buy, they're about 40, $50 now for a finger oxygen saturation monitor. So something to think about. You can probably buy it, if you do get sick, but that's something we're giving for recommendations. You can run it by it. We're not going to see you because we don't want to get exposed either. And I think you're not going to be either. But so 14 days, lock it down and, watch your favorite show.
Yeah.
Sound like a plan?
Yeah, if you're asymptomatic and you've not come across somebody who's been exposed, you can keep going about life regularly. I've had a few calls with that. I haven't been exposed, but do I need to lock down anyway? It's different. There's social distancing, and then there's locking down because you have been exposed.
Right.
And so,
Do you think we're going to be going to a lockdown at some point in this area?
well, I mean, statewide, we've got, already all non-essentials have been asked to close down, and they have. But there's a lot of stuff out there that is still considered essential, and because of that, there's still folks running around, and the potential to spread is considerable. Will we run on a lockdown? The latest thing that I've seen is we will be amongst the last states that will peak. We're looking to peak in May, and I think, looking at my non-existing crystal ball, that we'll probably peak a little later than the rest of the state. Some of our more metropolitan areas, like up in Northern Virginia, Richmond, out towards the beach area, those places will be exposed first, and then us out here in Central Virginia probably a little later.
Well, let's hope the weather, let's hope this thing peters out. Let's keep our fingers crossed. We'll talk more next week, and we'll just keep giving people updates. Let's hope you and I get a little smarter by next week too. All right?
All right, thank you.
All right, man, I'll talk to you.